Hello, I'm Stephen Mcculley. I'm a consultant reconstructive and aesthetic surgeon, and I'd like to talk to you about blepharoplasty, or eyelid tuck or eyelid surgery. This is a very rewarding operation because it is frequently the eyes which become sort of the gateway of freshness or youthfulness to the face, and it's not uncommon for me to actually advise patients to have their eyes done even though they may have come to see me for a facelift. Now, eyelid surgery needs to be separated between the upper eyelid and the lower eyelid. The most common problem in the upper eyelid is extra skin, and so you actually get some extra skin hanging down and hooding, and that appearance can also interfere with your makeup. By contrast, the lower eyelid, the combination of problems is usually a fat bag, because you have some fat underneath the eyeball, and as we get older that bulges out. You may have some extra skin or some fine wrinkles. If we start with the upper eyelid, that is a very straightforward and relatively predictable operation where both the skin and excess muscle are excised and you're left with a scar hidden nicely within the new crease, and therefore we can create some nice crispness and freshness to the upper eyelid. By contrast, you need to be a little bit more cautious on the lower eyelid. Not that we can't create great changes, but more problems are potential on the lower eyelid, and it's very important we avoid any pressure which causes the eyelid to be pulled down. What it's very good at doing is treating fat bags, and that can be either done by removing the fat or sometimes redistributing it and even pushing it into the groove that you might have underneath the eye. The upper eyelid has the scar in the crease, the lower eyelid has the scar just below the eyelid margin. Sometimes we do just one, sometimes we do both together. Now, this is all routine surgery, but there are uncommon potential risks, and those include bleeding, infection, variable scarring, slight differences between the two sides. And I have talked to you about some risks of altering the eyelid position, but it's very important that your surgeon avoids those risks as best possible by certainly either tightening the eyelid up a little bit, which may be done at the time of surgery, or certainly not taking too much skin away from the lower eyelid. I've certainly found this to be a very rewarding and very consistent operation over the years, and whether you're going to come to see myself or someone else, I wish you all the best with your eyelid surgery.